Welcome to the City of Columbus COVID-19 Supervisor Awareness Training. This training was developed as a tool to help City of Columbus supervisors during the COVID-19 pandemic. During our training today, we will cover the following topics: the City of Columbus guidance documents and where to find them, definitions of quarantine versus isolation, what should a supervisor do if an employee fails a pre-screening health check, what are some exemptions to quarantine? What should a supervisor do if an employee becomes ill while at work or calls with a positive test result? What are close contacts and how might a supervisor be involved in contact tracing? And procedures for returning employees to work following a reported illness. The City of Columbus has multiple guidance documents that discuss how to work safely during the COVID-19 pandemic. These documents include the City of Columbus COVID-19 Safe Work Practices Guidance, the COVID-19 Safe Work Practices Frequently Asked Questions, the Human Resources Questions and Answers, as well as positive COVID test flowcharts. These documents are updated frequently and contain the most up-to-date information about safe work practices for COVID-19. Be sure to become familiar with these important documents. Please note, this is a quickly evolving pandemic. Recommendations in work practices are subject to change quickly if recommendations from Centers for Disease Control, the Occupational Safety and Health Administration, Ohio Department of Health, Columbus Public Health, Citywide Occupational Safety and Health Program, or your department or division change. Please note, the COVID-19 Safe Work Practices and FAQs are best management practices designed to supplement, not replace, any mayor executive orders or policies, or any department or division policies, procedures, or guidance. You can access the most up-to-date City of Columbus COVID-19 policies and guidance by visiting the City of Columbus Employee Intranet page and selecting the Human Resources Department from the home screen. From the main Human Resources Intranet page, you can select any of the COVID-19 guidance documents, policies, or programs that are available. The City of Columbus COVID-19 Safe Work Practices Guidance covers guidelines and requirements to protect City of Columbus employees and visitors during the COVID-19 pandemic. Some of the guidance included in this document are daily health monitoring requirements, recommended hygiene practices, facility and building considerations, and additional guidelines for field work. This document is updated regularly, and each new version includes updates and changes in red. The City of Columbus COVID-19 Safe Work Practices Guidance Frequently Asked Questions covers questions and inquiries that have arisen during the COVID-19 pandemic. Examples of these questions include: who is at higher risk of becoming seriously ill with COVID-19? What is the difference between quarantine and isolation? What if I am a close contact to a COVID positive case but do not get contacted by the health department? Where can I find information regarding the COVID-19 booster vaccine? This document is updated regularly, and each new version includes updates and changes in red. The Human Resources Questions and Answers document addresses human resources specific questions regarding things like leave, pay, and return to work during the COVID-19 pandemic. There are 2 COVID positive case flowcharts for human resources representatives and supervisors to follow. There is one chart for critical infrastructure employees and one chart for non-critical infrastructure employees. These charts walk you through what to do if there is an employee who tested positive for COVID-19. If you aren't sure if your employees are critical infrastructure or not, please contact your department or division human resources professional, your department or division safety professional, or the Citywide Occupational Safety and Health Program. Let's first discuss the difference between quarantine and isolation as it pertains to COVID-19. The term isolation is reserved For those who have tested positive for COVID 19 or been clinically diagnosed with COVID 19. When you are isolating due to having COVID 19, you should be staying away from others, even within your own household, if possible. The purpose of isolation is to keep infected people away from healthy people to prevent the virus from spreading. Your isolation time frame is determined by the health department or oftentimes your healthcare provider. Quarantine, on the other hand, means the separation of a person or group of people reasonably believed to have been exposed to a communicable disease such as COVID 19, but who aren't yet symptomatic, from others who have not been exposed. This is also accomplished in order to prevent the spread of COVID 19. You can be quarantined if you are a close contact of someone with COVID 19. A close contact would include anyone who was within 6 feet of the person with COVID 19 for 15 minutes or more within 48 hours of that person becoming symptomatic or testing positive or is asymptomatic. For further information regarding close contacts, quarantine, and isolation, please refer to the City of Columbus COVID-19 Safe Work Practice Guidance and FAQs, or reach out to your department or division, human resources professional, or safety professional. Prior to coming to work each day, City of Columbus employees must self-evaluate for COVID-19 symptoms. Additionally, confirmation of this health self-evaluation must be made upon arrival to work. The confirmation at work can be performed in a variety of ways, including the message that appears at your computer login screen. Employees with any of the following symptoms must not report to work and must call their supervisor for next steps. A fever. A fever is when your body temperature is greater than or equal to 100.4 degrees Fahrenheit. A new or worsening cough. Keep in mind that employees returning to work following a COVID-19 illness may have a persistent cough long after they have recovered. Shortness of breath or difficulty breathing, fatigue, headache, new or worsening congestion or runny nose, nausea or vomiting, diarrhea, chills, muscle or body aches, sore throat, or new loss of taste or smell. Supervisors should contact their department or division human resources officer to determine next steps for the employee. In addition to self-monitoring for symptoms of COVID-19, employees must determine if they should stay home based on exposure to COVID-19. Prior to reporting to work each day, employees must assess their exposure to COVID-19 to determine if they should report to work. Employees must ask themselves, are you currently being tested for COVID-19 based on COVID-19 symptoms or based on recommendation by a healthcare provider or health department? If so, do not report to work. The employee or supervisor should notify their department or division human resources representative so appropriate contact tracing can be conducted. Have you tested positive for or been clinically diagnosed with COVID-19? If so, do not report to work. The employee or supervisor should notify their department or division human resources representative so appropriate contact tracing can be conducted. Are you a close contact of anyone being tested for COVID-19? If so, do not report to work unless you are fully vaccinated or recently recovered from COVID-19 and you are symptom-free. Refer to the COVID positive flowchart and FAQs number 16 and 24 for more information. Are you a close contact of anyone who has tested positive for or been clinically diagnosed with COVID-19? If so, do not report to work unless you are fully vaccinated or recently recovered from COVID-19 and you are symptom-free. Refer to the COVID positive flowchart in FAQs number 16 and 24 for more information. Please note, you or someone in your home who is asymptomatic and being tested for COVID-19 in preparation for a medical procedure or for travel or simply for peace of mind would not disqualify you from reporting to work. When working with your department or division human resources officer, the employee will be instructed to do the following. The employee must not report into their physical work location. We will cover what to do if an employee becomes ill at work later in the training. The employee should contact their healthcare provider to obtain a COVID-19 test or a clinical assessment for COVID-19. Employees who had and fully recovered from COVID-19 illness within the previous 3 months do not need to be tested for COVID-19. These employees may return to work once they are fever-free for 24 hours without medication and symptoms of illness have improved. It is important to keep in mind that at times of COVID surges within the community, it may be difficult for employees to easily reach a healthcare provider or access to a test, though this has become less common. Please refer to the most recent version of the City of Columbus COVID-19 Safe Work Practices and FAQs for information regarding at-home COVID testing. If the employee receives a negative clinical diagnosis or negative test for COVID-19, the employee may notify their supervisor verbally and return to work based on the following. The employee may return to work immediately if they are symptom-free and can pass the pre-screen health check, or if they are still experiencing symptoms, the employee may return to work once they are fever-free for 24 hours without medication and symptoms of illness have improved. What if the employee tests positive or receives a positive clinical diagnosis for COVID-19? The employee should not return to work and should contact their healthcare provider for instructions. If they do not have a healthcare provider, call Columbus Public Health at 645-1519 to be connected to a healthcare provider. The employee will likely not be contacted by a health department for a few days. The employee's healthcare provider can put the employee in isolation protocols for a COVID-19 exposure. Your department or division human resources office can and may ask for verification of quarantine or isolation orders from the employee's healthcare provider. Next, your department or division human resources office should initiate the COVID-19 positive case flowchart, which includes steps for contact tracing and possible cleaning of the employee's work area. As a supervisor, you will likely be involved in this process, particularly in the contact tracing to determine who the ill employee was with while or prior to becoming ill. There is an exception to being required to take a COVID-19 test following an illness or failing the pre-screen health check. If you've recently received the COVID-19 vaccine and are experiencing symptoms consistent with the vaccine, you may not need to take a COVID-19 test or be clinically diagnosed if you fail the pre-screen health questions. Employees may return to work following failure of the pre-screen health questions without a COVID-19 test or clinical diagnosis under the following conditions. Symptoms are consistent with COVID-19 vaccine side effects and symptoms started within 24 hours of receiving the vaccine and symptoms resolve within 48 to 72 hours, then it is reasonable for the employee to return to work without a COVID negative test or negative clinical diagnosis for COVID once they are no longer experiencing symptoms. If an employee is returning to work following vaccine-related side effects and returning without a COVID test, you may ask to see, not make a copy of their COVID-19 vaccination card. What steps should be taken when an employee tests positive for COVID-19? These steps will be taken in coordination with your department or division human resources office and can be found in the COVID positive case flowchart. Be sure to pull up the most recent version of the flowchart from the Human Resources intranet page to be sure you have the most up-to-date information. First, isolate areas the employee spent time in within 24 hours of becoming symptomatic. If the employee was not symptomatic, isolate areas the employee spent time in within 24 hours of being tested. Next, contact facilities or your property maintenance company for cleaning the areas the employee frequented prior to becoming ill. Current guidance for cleaning crews is as follows. However, this guidance is subject to change. If less than 24 hours have passed since the person who is sick or diagnosed with COVID-19 has been in the space, clean and disinfect the space. If more than 24 hours have passed since the person who is sick or diagnosed with COVID-19 has been in the space, cleaning is enough. If more than 3 days have passed since the person who is sick or diagnosed with COVID-19 has been in the space, no additional cleaning beyond regular cleaning practices is needed. The next steps that will be taken by the department or division when the employee tests positive for COVID-19 involves contact tracing. During contact tracing, we never want to disclose the name of the COVID positive person to other employees or clients. The department or division human resources officer should start contact tracing close contact employees or clients once they are notified of an employee positive case of COVID-19 or upon notification of an employee testing due to symptoms or at the recommendation of a healthcare provider. A close contact is any person who was within 6 feet of the COVID positive employee for 15 minutes or more cumulative when the COVID positive employee was symptomatic or 48 hours prior to when the employee became symptomatic or 48 hours prior to when the employee tested positive for asymptomatic cases. Please see additional definitions of a close contact in the most updated version of the COVID-19 Safe Work Practices and FAQs. If there are employee close contacts, advise them to quarantine unless they are exempted. We will discuss exemptions from quarantine on the next slide. If there are client close contacts, advise them they are a close contact to a COVID positive case. Do not disclose the name of the COVID positive person to other employees or clients. There are 2 situations that would exempt someone from needing to quarantine following a close contact to a COVID positive person. First, an employee who has had COVID-19 illness within the previous 3 months and has recovered and remains without COVID-19 symptoms, for example, fever or shortness of breath, does not need to quarantine following a close contact exposure to COVID-19. Please note, loss of taste and smell may persist for weeks or months after recovery. 2. An employee who is fully vaccinated and is showing no symptoms of COVID-19 does not need to quarantine following a close contact exposure to COVID-19. Please note, the use of face coverings, N95s, or other PPE does not exempt an employee from being a close contact. Fully vaccinated people should get tested 5 to 7 days after their exposure, even if they don't have symptoms, and shall wear a mask indoors in public for 14 days following exposure or until their test result is negative. HR may ask employee to provide a CDC COVID-19 vaccination card for verification of vaccination dates. What should I do if an employee becomes ill while at work? Isolate or remove the ill employee immediately. The employee should go home, and the same steps that are taken when an employee fails the pre-screen health check should be followed. Keep other employees away from the ill employee's work area until it is cleaned. Call facilities management or your property management company to clean the areas the employee frequented while ill or before becoming ill. Do not wait for a COVID-19 test result to initiate cleaning. If the employee tests positive for COVID-19, initiate the COVID positive flowchart. If an employee appears to be ill at work, can I ask them about their symptoms? Yes. During the pandemic, a supervisor or human resources officer may ask an employee if they are experiencing symptoms of COVID-19. The supervisor must maintain all information about the employee illness as confidential medical information, but should report this information to their human resources officer immediately. Employees experiencing symptoms of COVID-19 illness must not remain at work. When do employees return to work following a COVID-19 illness? This process should be conducted through your department or division human resources office. However, you may be involved in this process. When employees recover from COVID-19, the following guidance is used. A healthcare provider's note is not required but can be requested by the Department or Division Human Resources Office. A negative COVID 19 test is not required and in most cases not recommended for an employee to return to work following a COVID 19 illness. Ideally, an employee will return to work based on recommendations from their healthcare provider or their local health department. However, in the absence of those recommendations, the following criteria can be used. For employees who experienced COVID 19 symptoms, the employee can return to work when at least 1 day, 24 hours has passed since recovery, temperature below 100.4 degrees Fahrenheit without the use of fever-reducing medications, and there is an improvement in symptoms, and at least 10 days have passed since the symptoms first appeared. For employees who did not experience COVID 19 symptoms, asymptomatic employees, following a COVID 19 diagnosis, the employee can return to work when at least 10 days have passed since the date of their first positive COVID 19 test, assuming they have not subsequently developed symptoms since their positive test. Please note, employees with COVID 19 who either experience severe and critical illness or are severely immunocompromised may remain infectious for up to 20 days. In such situations, the employee should seek consultation with their healthcare provider and/or infection prevention and control experts to determine the appropriate time to return to work. What should I do if I have a question for a situation not covered today? If you have any questions regarding COVID 19 as it relates to your position as a supervisor, please reach out to your department or division, human resources office, or safety professional. Additionally, you can contact the Occupational Safety and Health Program. Thank you so much for your time. Stay safe.